can't see what they do.
Yeah, he can.
Okay.
Yeah, yeah.
All right.
It's kind of like with the sun in the eye.
Well, good afternoon, everyone. It is afternoon now. It's right before lunchtime. Also out there into our web world. But before I forget, I always do it at the end. If you have any questions in the web world, please email Miss Patricia J. Lewis. She is in Firebird. Okay. Right. We have Mr. David Santana from Medicare.
Thanks. Good morning, everyone. Thanks for giving me the opportunity to come here this morning and share some information about the Medicare program and our health insurance, the FHP program. So I think the main reason we as federal employees and retirees need to know a little bit more about Medicare is because it is one of the choices that we have as federal employees. Sometimes, choices are good things, but sometimes it complicates things as well. If you don't have choices, you only have one option, there is no need to worry about anything else. But when we have choices, we do need to evaluate those choices so we can make the best out of it. So this is what this presentation is about today, giving you some basic information about the choices that you have, specifically the Medicare program. The Medicare program has been around since 1965, and it's one of the most popular and successful form of health insurance coverage. And Medicare is one of our options as federal employees as we retired. We have been also given the choice of whether or not to enroll in Medicare. It's worth noticing that we are the only group out there that is still has a choice of whether or not to enroll in Medicare when we retired. Everyone else, including those who are covered by TRICARE, do not have such a choice to enroll in Medicare, and everyone else that have private health insurance outside of the FHP program do not have such a choice. So it is important for us to have some basic information about Medicare so that when the time comes, we can make a good choice. That choice would impact not only your healthcare coverage, but also could have financial consequences if you don't make the choice when we gave you an opportunity to do so with regards to Medicare. So this group is small enough that we probably may be able to just take questions as we move through the presentation, so that you don't come here looking for information and leave more confused than what you came. So if a question popped in mind, just raise your hand and we'll try to address it as we go through the presentation. So let's take a quick look at some basic information about Medicare. So Medicare is a federal health insurance program, and it is for three groups of individuals. The original Medicare program that was signed into law back in 1965 was a simple program for people who were 65 years of age and over. The program was expanded in 1972 to include two additional groups of people: those who have a disability and getting Social Security disability benefits for at least 2 years, and those who developed end-stage renal disease that require dialysis or kidney transplant to maintain life. So we do have a large amount of individuals, over 10 million people that has Medicare, and they are under 65, either because they have a disability or because they have been diagnosed with end-stage renal disease. Now, the overall administration of the Medicare program lays under the Centers for Medicare and Medicaid Services. That's the agency that I work for. and we are an operating division under the Department of Health and Human Services. We are a small agency, about 5,600 employees, but we oversee about 140 million people in the U.S. Have some type of coverage under the programs that we oversee. That is Medicare, the Medicaid program, the Children's Health Insurance Program, and the Federal Health Insurance Marketplace created under the Affordable Care Act, and that also people know as Obamacare. Now, while we have the overall administration of the Medicare program, the Social Security is still a partner of us. It's kind of one of our contractors that process Medicare enrollment. That is just about what Social Security do with Medicare. They help you enroll in Medicare. Anything else goes through Medicare. So once you process that enrollment, that information is forwarded over to CMS, to Medicare, and then we'll take it from there. Any problems that you have thereafter, you deal with Medicare. If you have problems signing up for Medicare for any reason, you could always reach out to Medicare, and we'll be happy to walk you through the process. So that's why Social Security is involved with Medicare, because they are the one that process the enrollment. Now, to understand a little bit about Medicare and how it's structured, Medicare has 4 parts, and this is what become a little confusing for us when times come to make a decision whether or not we would enroll in Medicare. Not just whether or not enroll in Medicare, but which part of Medicare should I or should not enroll. So Medicare have the original 2 parts, which is hospital insurance and medical insurance. And again, that was a simple program back in 1965. It provided hospital care for those individuals that became inpatient in a hospital through Part A, and then Part B is the medical part, doctor services, laboratory tests, durable medical equipment, and so forth. So that was the program back in 1965. In 1997, the program was expanded to allow people in Medicare to have their health insurance administered by a private company. Pretty much the companies that operates our own health insurance. Those same companies, or the majority of those companies, also operate Medicare Advantage plans. And again, it's a Medicare Advantage plan. It's just basically similar form of private health insurance as the one we have. They have HMOs, they have fee-for-service, PPOs, and so forth. So Congress expanded that option to people in Medicare so that if they want a private company to administer their health care, they could do so. If they enroll in one of those private plans, we transmit that information to that specific plan. We pay them a set amount of money every month to those plans to enroll those individuals, and then the individuals simply follow the rules of that plan. Of course, we do oversee those plans. Those plans have to apply, and we approve those plans, and at the same time, we also audit those plans to make sure that they stay within the contract mandate with CMS, and we also have the authority to terminate the plans if they're not honoring the contract that they signed with Medicare. So you do have that protection. So you're probably wondering, well, I have FEHP. Why do I even need to know about a Medicare Advantage plan, which is another private plan out there? And as far as you probably know, FEHP is one of the best coverage, private coverage that you could have out there. So I'm going to tell you a little bit more about Medicare Advantage plan and why you should know about them, because it is yet another choice that you have when you retire. If you want to opt to have one of these plans, what would be perhaps the advantage of going with these plans as opposed to staying with your regular FEHP plan? Lastly, Medicare Part D was introduced in the Medicare program in 2003, Medicare Modernization Act. Up until then, we do pay for individuals to go to the hospital to see the doctor. They typically came home with a plan of care that includes some drug regimen for this individual to get better or to manage their disease, but we did not pay for medication. So that individual was, right back into the hospital, not only costing the program a lot, but it's also detrimental to their quality of life. So that option was introduced to the Medicare program to allow people in Medicare to sign up for a private plan that will pay for prescription medication. We're also going to tell you a little bit about this option with regards to your FEHB coverage, the coverage that you have, and whether or not it is advantageous or not so advantageous for you to enroll in the Medicare Part D plan. So those are the 4 parts of Medicare, what they stand for. As always, when we have choices, the first thing that comes to mind is what is in that choice? What is it? What am I get out of it? And how much it's going to cost? So Medicare Part A is hospital insurance. It's premium free for all of you that are sitting in this room and your family members. That is whether you are under the old retirement system or the new retirement system. If you were under the old retirement system that you didn't pay Social Security taxes, you are grandfathered in, you get Medicare Part A free as well. So, in fact, Medicare Part A is premium free for 99.9% of people in the U.S. That is because they work at least 10 years and they paid into the system. And you probably heard from the person from Social Security that they talk about working credits. Those who did not work and are not married to somebody that worked can still enroll in Medicare, but they have to pay a monthly premium. The monthly premium for Medicare Part A is $422 a month for each individual if you have to pay for. But again, those of you sitting in this room and your family members also get Medicare Part A premium free. So when we move on to decide whether or not to enroll in Medicare later on, this is one thing, this is fact number 1 that you need to keep in mind. Medicare Part A is premium free. When somebody is offering you something for free, most likely, if it's not going to affect you in any other way, most likely you will take it. So what can you expect to get from Medicare Part A? Hospital insurance, pretty much everything that you get inside the hospital. Medicare is a nationwide health insurance, so you can go to any hospital in the U.S. that is approved by Medicare, also in the U.S. territories, but not outside of the U.S. So Medicare do not have coverage outside of the United States and the territories. You could also expect to get skilled nursing facility care, home health care services, hospice, and so forth. 2 pieces of information in here to keep in mind. Skilled nursing facility care and home health care are services that are offered at almost 100% by Medicare, but is very limited, if any, with our FEHB plans. As we age, we would need therapy. Something happened, you need skilled services that could only be provided in an institution. We pay at 100% of that for the first 20 days, and then we paid an unlimited amount of visits and services on their home health care services that we send somebody to your home to provide skilled services, physical therapy, occupational therapy, speech language pathologies, things that we need when we age, and those services are really expensive, and again, they are almost non-existent on our FEHB plan. So it's important for us to keep in mind when we make a decision, not only focus on how much Medicare is going to cost you, but what am I going to get out of Medicare? You can see that although Medicare Part A is premium free, there are costs associated with the coverage when you receive the service. So you do have deductibles, and then you have co-payments and co-insurance. $1,300 if you go into the hospital, and that'll cover you for 2 months in the hospital. That's a deductible. If you happen to stay in the hospital longer than 2 months, then you have to start paying a co-payment of $335 a day. And then if you happen to be in a hospital longer than 90 days, then you fall into what we call a lifetime guarantee reserve day. Those are basically 60 days that you have in there that you can use, but still you have to pay half of the deductible every day. And then if you happen to stay in a hospital or a skilled nursing facility for more than 150 days, you can see that Medicare hospital insurance stops. So I get many questions from my federal colleagues indicating, well, if the moment you hear that something is free, you're thinking, well, I'm paying FEHB here. I wonder why I wouldn't just go into Medicare Part A if it's premium free and forget about my FEHB. I included that slide in here to tell you that although it's premium free, is not an all-inclusive program. Another thing to know about Medicare is that it does not offer catastrophic protection. How many of you are familiar with the term catastrophic coverage? 2 people. So do you, the health insurance that you have, your FEHB plan, if you look at the plan brochure, you will see that you have catastrophic coverage or maximum out-of-pocket protection. All our health insurance offer maximum out-of-pocket protection. This is basically to protect people from going bankrupt if they have a medical event. The average maximum out-of-pocket protection for an individual within our FEHB plan is about $5,000 to $7,000 a year. That's how much we are expected to pay before the plan step in and pay 100% of your coverage for the rest of the year. So if you reach that maximum out-of-pocket protection, that's as much as you're going to pay out of pocket for the rest of the year, and then the following year begins. Medicare does not have maximum out-of-pocket protection, so the expenses keep coming, and there is no protection there. So that's why it is important that although this is a good benefit, it's important for us to keep what we have, because that would encompass what Medicare offered to provide comprehensive coverage. Now that's a skilled nursing facility, and again, we pay 100% for the first 20 days. Services in the skilled nursing facility are really, really expensive. The average 3 days hospital stay, depending on the intensity of care that you get, is about $30,000 nowadays. So it becomes really expensive when you have to be in an institution for longer than 3, 4, or 5 days. So Medicare do cover 100% of that, and then from day 21 to day 100, you do have a copayment. When you do combine Medicare and FEHB, those expenses are picked up by your FEHB plan. Again, if you don't have Medicare, likely you would not have much skilled nursing facility care coverage or home health care coverage as well. The next few slides talked a little bit more about Medicare Part B. Now, I mentioned that Medicare Part A is premium free. Now, Medicare Part B comes at a cost. Everyone pays Medicare Part B premium. If you hear of someone that is not paying, it's because someone else is paying on their behalf. But everyone pays for this. Medicare Part A premium is free for the majority of people because you work and you pay taxes on it. Now, nobody pays anything towards Medicare Part B other than the premium when you become eligible and you signed up for Part B. So again, the next few slides just give you an overview of what you can expect to get out of Medicare Part B: doctor services, outpatient medical services and supplied, home health care services. Look at the list of those services that are offered under Medicare Part B. And again, this is for us to consider when we are deciding whether or not this is a good choice for us when we retire. Those services are scarce or non-existent with our FEHB, but you can see that there are existing within Medicare, and there is no limit on the amount of service that we provide to an individual in their homes. Now, we also pay for durable medical equipment, and you can see the list of preventive services that we pay for that are basically free of charge to individuals with Medicare. So those are the services that you get under Medicare. So how much Medicare Part B actually costs? That's a big question. You do have a deductible. As we have a deductible probably with your FHP plan that you have, you can see that you would have a deductible as well. So the deductible with Medicare is $183. That's the first dollar amount that you would pay in a year. And then Medicare comes in and paid 80% of your doctor services and everything else, and you are expected to pay 20% of those charges. Now, the big question is how much Medicare Part B is going to cost me. So for the vast majority of individuals, almost 94% of people with Medicare paid that basic premium that is $134 a month. If you are filing taxes as a single individual and making more than $85,000 a year, you can see that you start paying a little bit more on your Medicare Part B premium. So it's typically 35, 50, 65, and 80% respectively. So the government, similar to our FEHB, the government subsidizes 70% of the cost for Medicare Part B. So the true cost of Medicare Part B premium you will find by multiplying $134 times 4. I think that is about $536 a month. But the government subsidizes 70% of that, 75% of that, and then you end up paying the 25% left, which is $134. But depends on your level of income in here, whether you file taxes single or join with the spouse. That's how much your Medicare Part B premium is going to cost you. So when you start kind of thinking about the numbers and how much Medicare Part B is going to cost me, and if I'm going to get a return for my investment, you heard about the maximum out-of-pocket protection, right? So for a single for a single individual, it's about $5,000 to $7,000 with your FEHB plan. If you multiply the basic Medicare Part B premium for a year, it's about $1,600. If you get to use the full extent of your coverage, of healthcare coverage, you typically are going to come up ahead by paying the Medicare Part B premium, because it's going to cost you about $1,600 a year, and you're going to end up saving in the long run. Not only that, but also the coverage that you get. I mentioned the skilled nursing facility, home health care, and other services that are covered by Medicare, but they are non-existent or very limited under our FEHB plan. Now, even if you are among those individuals right here on the bottom that will pay 80% of the premium, even those individuals, if you multiply that by a year, it comes to just about $5,000 a year. So even that group of individuals enrolling in Medicare Part B may make a difference there. When I talk about those maximum out-of-pocket protection of $5,000 to $7,000 or $10,000 to $15,000 for individuals who have joint policy, that only includes services that are within the network of the plan. If you go outside of the network, that's higher, and services that are not covered by the FEHB also are not included on that calculation of the maximum out-of-pocket. That is to say that your maximum out-of-pocket could be much more higher than $5,000 and $7,000 or $10,000 or $15,000. So even when you look at those numbers, it make much more sense to enroll in Medicare Part B just by looking at the numbers. So we do have some basic information now about what is Medicare Part A. It's hospital insurance. First fact of Medicare Part A is it is premium free for the majority of us. and it doesn't offer a catastrophic coverage. So although it's a good coverage, we do need something to supplement that part of Medicare. What do we know about Medicare Part B? It does come with a premium. Everyone have to pay for it, and it's based on your income. What also do we know about Medicare Part B? That it offers a lot of services that may not be covered by your FEHB plan. So that now that we have some basic information about Part A and Part B, let's see how you get enrolled in Medicare. So the only two group of individuals that will get automatically enrolled in Medicare, meaning that they don't have to do anything, are those who are receiving Social Security retirement benefits before they turn 65. So you can apply for retirement benefits as early as age 62. If you do apply for benefits, retirement benefits before you turn 65, 3 months before you turn 65, you will receive a Welcome to Medicare package from Medicare with the Medicare card, and it basically telling you that you are now enrolled in Medicare Part A and B if you are getting Social Security or railroad retirement benefits. And again, this is the only group of individuals that will be automatically enrolled in Medicare. Everyone else would have to apply when we gave them the opportunity to do so. So when individuals can enroll in Medicare, so the first opportunity to enroll in Medicare is during what we call initial enrollment period. Initial enrollment period is about 7 months and is around your 65th birthday, 3 months before, the month, and 3 months after your birthday. So the 7-month period that you can come in Medicare, that is the first opportunity to enroll in Medicare. If you miss that opportunity, your next opportunity will be general enrollment period, so that's not the end. Every year from January through the end of March, you can come and enroll in Medicare if you miss that initial enrollment period. However, you need to keep in mind that if you do not enroll when we gave you that opportunity, you could face a lifetime penalty. The penalty is 10% for each 12 months that went by and you could have been enrolled in Medicare Part B, but you did not. That penalty is based on the premium that year. So if the premium this year is $134 and you waited 5 years, you're going to be paying 50% penalty on $134. If that premium goes to $200 next year, you're going to be paying 50% of $200 and so on and so forth. The penalty will last for lifetime. So that's another thing, because many of my colleagues say, well, yeah, I waited 5 years and I saved that monthly premium for Medicare Part B. So $1,600 that you save every year for 5 years, you probably save around $6,000 in 5 years. But then if in 5 years the premium is $200, you're going to be paying $300. How long before you can actually deplete that saving? It's not going to be much longer before you deplete the savings, and then you're going to start paying more. You probably heard of many studies that have come out over the years that if we live long enough to be 65, it is expected that we'll live at the very least another 25 years. So we are living longer and longer. And those financial decisions that we make in the short term is going to affect us in the long term. And again, you may see some savings in the short term, but in the long term, you're going to end up paying much more if you don't make the right decision at the right time, and that's why we're here. Now, there's always exceptions to the rule. We do have a special enrollment period, and that is for those of us who are actively working. For as long as you're actively working and are enrolled on your FEHB, either through yourself or a spouse who is actively working, you do not need to enroll in Medicare Part B when you turn 65. We do recommend that you do enroll in Part A, but Part B, again, if you're actively working, it is likely that you will not get much return for your investment because your FEHB plan will be your primary health insurance. So Medicare as a secondary, you may be paying that premium every month, and you may not get much out of Medicare as a secondary payer, because after your plan paid, it's very little left for Medicare to pick up. So again, you may not benefit from signing up for Medicare while you are actively working. So again, if you're actively working and have FEHB and your spouse is under your policy, you and your spouse do not need to enroll in Medicare Part B when you turn 65. Even if your spouse is out there retired over 65, for as long as that spouse is covered under your policy and you're working, that spouse doesn't need to enroll in Medicare as well. It's important to understand that distinction, because the last time I came here, there was one of your colleagues that I think it was covered under a spouse policy, and the spouse was retired a long time ago, but that person was actually covered under that spouse policy, and that person itself was way over 65, so waited all these years thinking that they qualified for a special enrollment period, but they didn't. Not only that person was losing on the on the savings and of course the penalty, elimination of penalty, but also there is a premium conversion. The premium conversion applies when you are actively working and paying for your health insurance. We don't pay taxes on that money, so that's taken before your taxes. So you save there as well. So that those two individuals were missing on the savings. They were paying taxes because after we retire, we have to start paying taxes for the health insurance that you're paying. So it's important to keep the policy with the individual that is actively working to take advantage of the premium conversion, as well as the Medicare protection, the special enrollment period. So now we know pretty much, we have a good understanding of Medicare, right? Now, Part A, Part B, how much it costs, what they covered. When can you enroll in Medicare? What are the consequences for not enrolling when you should? So we should be in a position to make an informed choice now, right? So should I enroll in Medicare Part A, whether I am working or retired? Who agree with me? You should enroll in Medicare Part A because it's premium free. If you're actively working, that's fine. Your FEHB plan will continue to be your primary health insurance. If you end up in a hospital, under your FEHB, you typically have to pay a deductible, and there may be some things that they do not cover in the hospital. If you do have Medicare Part A, after your FEHB process the claim, that claim could be sent to Medicare, and Medicare will evaluate that claim for payment. Those deductibles and copayments that you see in there, if you have your FEHB as a primary, Medicare take into account how much they already pay and apply that towards the deductible. That is to say that much likely Medicare will help pay for your hospital bill as a secondary policy if you do have both Medicare and FEHB. So whether you're working or retired, I think we all understand now that I would enroll in Medicare Part A. How would you enroll in Medicare? You either go online, socialsecurity.gov or medicare.gov, and you will see in there applying for Medicare. You can fill out the application right there online and submit it to Social Security for processing. The only instance that I would recommend to delay enrollment in Medicare Part A is if you have a health savings account. How many of you here have what we call a high deductible health plan? So high deductible health plan is one of the options that we have, and those plans have a pretty high deductible, about $5,000 that you have to pay first, $5,000 that you have to pay first before the plan begin to pay for your health care. Those individuals usually set up a health savings account on the side. It's the money that you put on the account that is tax-free to help you defray the cost of that deductible. if anyone has an account like that, once you signed up for Medicare, you're no longer able to contribute to that account, so you have to stop contributing. That is why the only instance that we would suggest not to enroll in Medicare Part A is if you have a health savings account. Not to be confused with a flexible spending account or health reimbursement accounts. Those accounts are different, and you are able to stay on Medicare and still have those accounts on the side. So it's a health savings account. Only go with a high deductible health plan. So if you don't have those plans, you don't have to worry about that. So the big question is Medicare Part B. So knowing what we know now, if you're actively working and your spouse is covered under your policy, should you sign up for Medicare Part B when you turn 65, when you're actively working? Yes? Nobody? No? So, knowing what we know now, you would not get much out of Medicare while you're actively working. So again, you turn 65, your spouse is covering your policy. You will not get much of a return for your investment by signing up for Medicare Part B. Now, if you do not, and let me just pause a little bit here. So if you do not sign up for Medicare Part B when you turn 65, you and your spouse, we give you 8-month special enrollment period when you retired to sign up for Medicare. So we give you 8 months after the month you retired to think about whether Medicare Part B is a good option for you. If you signed up during that time, there's no waiting, there's no penalty, and your coverage will begin the following month. It is important to look at this bullet before the last bullet. That is, it says get form CMS L564. So that form is important because that is the form that Social Security will use to determine whether you qualify for that special enrollment period. Technically, when you are about to retire and you're getting all your paperwork in order, that form should be one of them that the individual should, in the agency should help you sign or fill out the form basically saying, you know, this person worked in here from this day to this day and they have health insurance up until this day based on current employment. The form is very simple. It only has 2 parts. Part 1, which the employer filled up, and part 2 is what you filled up, is basically saying, I am this person, I work here, and this is, and I have health insurance. So it's a very simple form. Now, how about when I retired? So based on the information that we went over this morning with regards to coverage, what do you get out of Medicare with regards to coverage, skilled nursing facility, home health care, and other services, as well as the cost of not enrolling in Medicare when we gave you the opportunity either through the initial enrollment period or the special enrollment period, which is 8 months after you retire. So knowing, based on that information, should you enroll in Medicare Part B after you retired? Do we all agree that you should enroll in Medicare Part B? It is beneficial to enroll in Medicare Part B after you retire. And again, one of the reasons is that Medicare is nationwide. You can go to any hospital, specialist, or doctor across the country, and Medicare would follow you wherever you go. When Medicare is primary, one of the things that OPM has been working with the plan over the past few years is to encourage the plan to offer more incentive for federal retirees to enroll in Medicare. So the plans are responding. Many plans for next year, this year already, are covering part of your Medicare Part B premium. Like all the Blue Cross and Blue Shield plans now are giving individuals $600 credit to help pay for that Medicare Part B premium. So that $1,600 become only $1,000 a year to have Medicare Part B. When you enroll in Medicare, the plans offer additional benefits that wraps around Medicare to provide almost 100% coverage. So I don't know if any of you have gone through a medical event or you have taken care of a family member that have gone through medical events. But once the individual goes into the hospital, those hospital bills are ginormous. The list goes on and on and on. You see a person laying in bed, and there is a book somewhere that people are signing as they are walking through that bed, and that could amount to a lot of money. If the insurance company happened to deny payment for any reason, before you know it, you would be on collection, even before you get out of the hospital sometimes. And it is very, very difficult to maneuver all of those bills. And then you start going from a specialist to therapies, and all those things start mounting and becoming very overwhelming for the typical individual, especially if you are ill or you're helping someone and you have your own work to do. So when you have the two programs, Medicare pays as a primary. That claim after Medicare then goes to your FEHB plan, and they likely pay for that. So the only thing that you receive is an explanation of benefits from both Medicare and your FEHB. Now, Medicare is, although it's a very successful program, over the years, we have been working really hard to put safety nets in place to make sure that providers are charging the right amount of money, and after we approve a claim and we say this is how much you're going to pay for, this is basically it for the provider. They can't charge you anymore. And then once your FEHB paid after Medicare, they just basically cover that gap, and then you're covered 100%. So that is yet another reason why you should strongly consider enrolling in Medicare Part B when you're first eligible, or during that special enrollment period. I already mentioned the pay for cost to seeing providers outside of the FEHB network. And also, if anyone here has TRICARE, or you wanted to try the Medicare Advantage plan, then you also need to be enrolled in Medicare Part B. I'm going to tell you just briefly a little bit about Medicare Advantage plans and why it's important for us to know some basic information. So these plans, first of all, they are approved by Medicare. To begin with, they have to pay for everything that Medicare pays for. So all of those services that I went over in the beginning of the slides, all these things have to be paid by those private plans. In addition to that, these plans offer additional coverage to incentivize people to enroll in those plans. What is the typical monthly policy for those plans? The premium, you could get many of these plans for zero premium. Some of the plans cost $5, some of the plans cost $10, $15, depends on what type of plan you may end up choosing. So that is to say that you would get everything that you will get under Medicare. You get additional services. You get prescription drug coverage. You will pretty much have the same thing. You just have one card, pay for hospital, medical, prescription drugs, and the monthly premium could be much lower than what you are paying with the FEHB. I guess the beauty of these in terms of choices that we have is that if you go back and you look in your zip code, Medicare.gov, and right on the front page, there's a link that says Find and Compare Health and Drug Plans. You click on there, it'll ask you for your zip code and whether or not you're getting Medicare. So it's just a couple of questions. And then it'll give you the list of plans that are offered within your zip code. You're able to see what those plans, how much it costs, and what are the benefits of enrolling on those type of plans. If you wanted to try one of those plans, you could do so. What would you do with your FEHB? You can suspend it, like put it on hold. Don't terminate your FEHB. So you do have the option to suspend your FEHB plan, try it out. Try the Medicare Advantage plan to see how it works. If it works, you can stay on the plan however long you want. If it doesn't work, you simply come back to your FEHB plan during open season. Unless something happened and you move out of the planned service area, you could always come back to your FEHB before the next open season. So what is my advice with regard to Medicare Advantage plan? It is a choice that you have as federal employees. Nobody else have the choice you have. And with regards to trying and coming back to your FEHB if you want to. So anyone else will tell you if you go, you stay out, you don't come back. But with your FEHB, you do have the option to suspend, try it out, and then come back to it. I heard many stories, talking to HR specialists in government and people trying these plans and being very, very satisfied with those plans. We do oversee those plans, and we make sure that they are providing the benefits that they say they will provide to the individuals. So with regards to Medicare Part D, what would be my advice? If you have FEHB coverage, you already have prescription drug coverage. If you happen to enroll in a Medicare Part D plan, which is your choice, if you wanted to enroll in Medicare Part D, you can. However, FEHB plan, let's say you retire, your FEHB plan will still not waive what you would typically pay at the pharmacy. So it doesn't make sense for us. You would not get a return for your investment by signing up for Medicare Part D in general. It's just because, let's say Medicare Part D is primary, you went and got a drug in the pharmacy that costs $200. Your FEHB plan typically will tell you, you pay a $25 copayment for that drug. Let's say Medicare pays, everything but $30. You still would have to pay your $25 copayment that you would normally pay if you did not have the Part D plan. So my advice with regards to Part D, you don't need it. Likely you would not get a return for your investment. However, these prescription drug plans are very comprehensive. Typically, the plans will pay 25%, or the individual will pay 25%, and the plans paid the rest 75%. So, if an individual, you heard about these specialty drugs that are costing thousands and thousands of dollars a year for some individuals. If there are drugs that are costing you a lot of money out of pocket through your FEHB plan, or they don't cover the drug for whatever reason, you could always look into Medicare. Look at the plans, because in that website you can actually search for plans based on the drugs that you're taking. So I say, I take Lipitor. I go there and put, I'm David and I take Lipitor, and I look for plans that would cover that drug, and it'll tell me how much it's going to cost me every month for me to have that plan with that drugs. And if it comes out that you actually may end up saving money, then you can enroll in a Part D plan at any time. There's no waiting period. There's no penalty for as long as you're covered by the FEHB plan. So my advice, typically you don't need it, but if you find yourself in a situation that you're spending a lot of money out of pocket, look into Medicare and see if you can save some money. If you see any savings, you could always take it for as long as you want to be enrolled in the plan. If anyone here has TRICARE, again, just keep in mind that TRICARE do require individuals to enroll in Medicare at age 65. Real quick, I wanted to go over coordination of benefits. So if you do end up enrolling in Medicare, it's important to know how coordination of benefits work. The rule of thumb is, for as long as you're actively working, your FEHB plan will be primary for yourself and your spouse, if your spouse is under your policy. Once you retire, it is important to know that it's not our choice. It is the law. Medicare will take over as your primary health insurance. Sometimes I get many questions because there are doctors who say, I will take Blue Cross and Blue Shield or another plan, but I wouldn't take Medicare. Unfortunately, if that is the case, you would have to find another doctor that will work with both Medicare and Blue Cross and Blue Shield, because the order of payers is dictated by federal law. And again, once you retire, you're over 65, you're enrolled in Medicare. Medicare will be your primary and your FEHB will be secondary. So that's basically a very quick overview of the basic of Medicare, you know, starting with the hospital insurance, a couple of facts in there, premium free, do cover hospital care, coordination with FHP, you almost get 100% coverage in the hospital. Medicare Part B comes with a premium, and the premium is based on your income. If you do not enroll when we first give you an opportunity, there could be a lifetime penalty that will last for lifetime. While you're actively working, you do not need to enroll in Medicare Part B because you will not get much return for your investment. However, when you retire, we strongly encourage you and your spouse to enroll in Medicare Part B because of all the benefits that we discussed. With regards to Medicare Advantage plans, it is a choice that you, or an option that you have as federal employee when you retire. Search for those plans in your zip code. See what they offered. If you see something that you liked, try it out. Call your retirement office and tell them that you want to put your FEHB on hold while you are trying this option. Stay enrolled there for as long as you want, or for as long as it's working for you. Medicare Part D, typically you don't need it, but if you have a lot of out-of-pocket expenses, check it out. You may end up saving some money. If you see some savings in there, you're free to try it, to enroll and keep that plan for as long as it's working. If it's not working anymore, you can always drop it and come back later on, because that special enrollment period remains for Medicare Part D, for the drug part. Whether you're working or retired, that special enrollment is still there for Medicare Part D. That basically concludes my overview. I'll be happy to take questions. Yes. Go ahead.
You said that at 65,
Please wait for the mic.
Required to take, you're required to take Medicare Part B. But what about if you leave the country and you actually live in another country? Then you say that the Medicare becomes your primary and the other one becomes your secondary. But since you're not in the States, how would that work?
Right. So great question. So when you turn 65 or after 65, whenever the case may be that you enrolled in Medicare, I mentioned that Medicare doesn't work outside of the U.S. I would say, no, it's not a blanket statement, because we do pay for certain things, certain services that happen in either side of the border, Canada or Mexico. If you have, if the hospital in any of those countries is closer than the nearest U.S. hospital, you could go there, and we paid on those limited circumstances. Or if you are on board of a cruise ship and you're still within 6 hours of U.S. Port, we also pay for those very limited circumstances. Outside of that, we don't have services outside of the United States, regardless of whether it was an emergency or not. So what would happen if you get out of the country? Your FEHB do have coverage outside of the United States. So your FEHB will be the only payer when you get services outside of the country. If you happen to receive the service that is not covered by Medicare, but is covered by your FEHB, then your FEHB is still your primary health insurance, because there was no payment from Medicare in those limited circumstances. Then your FEHB will step in and pay. That's the only payer. Many people ask me, okay, if Medicare is not going to serve me outside of the U.S., what am I going to do with Medicare Part B? Would I still paid and I don't get anything while I'm out of the country? Unfortunately, that is the case. You don't have to be enrolled in Medicare Part B. You can drop it if you liked, but keeping in mind that if you drop it and then you come back to the U.S. and you want to get it back, you have to wait until the beginning of the year, and then you would face a lifetime penalty for re-enrolling again outside of that special enrollment period that we gave you. There was another question in the back? Yes.
Yeah, I got a two-part question. One is if you're still working and we still have the government insurance, and I end up buying Part B after I retired, okay? Then, but I still carry my government insurance. Is the government insurance the primary, or is Part B the primary at that time?
While you're actively working, your government health insurance will be primary.
Okay.
Once you retired, Medicare will take over as your primary policy.
Okay. The second part question is, I've received the Part A new card.
New Medicare card, right?
Yeah. Now, when I sign up for Part B after I retire, are they going to send me one card that says A and B, or are they going to send me two cards?
They're going to send you a brand new card that will have Part A and Part B on it.
Okay. Thank you.
You're welcome. Right here.
I'm not sure about the premiums.
Oh, you have a mic back there? I'm
Yes.
sorry. You can bring the mic in here next. Yes, go ahead.
Okay. Well, I'm not sure about my wife's coverage. I turned 65. I get covered for Part A and B. Is my wife automatically covered when she turns 65, or does she have to apply separately? And does that premium cover both of us, or do we each pay a separate premium?
So you're actively working, right?
Actually, I don't know if I will be at 65.
Okay, but right now you're actively working.
Correct.
And your spouse is under your policy.
Correct.
So you're asking, when you turn 65, if you retire, what's going to happen then? Is that correct?
Let's assume I do retire.
At 65, okay.
And I apply for Part A and B.
All right.
I'm paying a premium. And my wife, who's younger, in like 3-4 years, she's going to turn 65. Does she have to apply separately? And if so, does she pay a separate premium, or does the premium that I'm paying cover both of us?
Great question. So what would happen is when you turn 65, if you go ahead and sign up for Medicare, you would have Medicare would be your primary, FHP be your secondary policy. For your spouse, because she's not 65 yet, she doesn't yet qualify for Medicare, so FEHB will keep paying for her as the only policy. When she turns 65, she has that 7 month, 3 months before the month, and the month after to sign up for Medicare at that time. That's the she will be able to sign up during that initial enrollment period. The money that you pay for Medicare Part B premium is individual. So each individual paid that premium separate. So Medicare does not have family policy or self plus one as FEHB does. So each one of you would have to pay the Medicare Part B premium separate.
Okay. One other question. You mentioned that we could do a cost analysis for Part D. Where do you go for that? Is that a website?
There's a Medicare.gov website, and you just go in there. I think there's a tab in there that's a Medicare cost, and it allow you to put some information in there to see how much it's going to cost you to have Medicare. That part that I mentioned, find health and prescription drug plans. If you clicked in there, the first thing, when you put your information, the first thing that is going to give you is how much Medicare is going to cost you, based on the information you provided. And then it'll compare that with, for example, enrolling in a Medicare Advantage plan. So to do a cost comparison there to see if you would be better off signing up for a private plan or staying in a regional Medicare. That tool doesn't include your FEHB, so you do have to kind of go and see the Medicare cost in there and then compare that with your FEHB to see if you may end up saving that way.
Okay. And does this cover any dental or vision?
Dental and vision. Medicare does not have dental coverage, so that's one thing that we could have dental coverage through separate policy with FEHB.
Even like an oral surgery type situation?
So in very limited circumstances, we may pay for, if you're having a surgery and you need some dental work done before you can have that surgery, then we would consider paying for your dental work, pulling teeth and things that are at risk for getting infected. Those things are covered, but when it's in relation to another medical surgery that you will get in the hospital. But again, those services are very, very limited.
Okay, thank you.
You're welcome.
My question is related to the advantage of retired spouse sign up for Part B if the retired spouse still under the coverage of the working spouse of a FEHB. What is the advantage?
So with regards to Medicare Advantage and what I mentioned, the choice that you have to enroll in the Medicare Advantage and suspend your FEHB, that could only happen when you retired. So you cannot suspend your FEHB while you're actively working. So if you retired and you have self+1 or family coverage, your spouse is under your policy, you will not be able to suspend your FEHB, because if you suspend your FEHB, you're going to suspend it for your spouse too. Unless, of course, if your spouse qualifies for Medicare, then both of you can go into a Medicare Advantage plan, and then you can suspend your FEHB. I hope that answered your question.
That is one of my questions, but my original question is, if the retired spouse have any advantage to have any benefit, additional benefit to sign up for Part B, if the retired spouse is under the coverage of the working spouse of a FEHB.
Right. So as we mentioned, there isn't really an advantage of you or your spouse, if your spouse is under your policy and you're actively working, to sign up for Medicare Part B, where you're still covered by your working spouse policy. So the same thing that applies to you applies to your spouse. I wouldn't recommend to sign up for Part B for as long as you're actively working and your spouse is under your policy. Yes?
Yeah, and that chart with the premiums, it said it's based on what you made in 2018, and it says $134 on the first line. Is that per month or is that per year?
So the $134 is a monthly premium.
Okay, so
is it month? I'm sorry?
You pay that every month.
Per person, right. So it's $134 is a monthly premium per person. So it's July 2018. If you signed up for Medicare, let's say you go in today and sign up for Medicare to begin, the following month. Social Security will share your Social Security number with the IRS. The IRS is going to be looking at the last taxes that you filed. Typically, the taxes that you filed last year for the year before. So it's like 2 years back that they will look and see what was your income. If your income is above one of those thresholds, the IRS will return that information to Social Security, and then Social Security will send you a letter saying, this is what we get from your taxes, and based on this information, this is how much your Medicare premium is going to cost you. Typically, when the individual, let's say you said, okay, well, I guess that's fine. But now I am retiring. I'm signing up for Medicare because I retired. That's not going to be my income any longer. So in that letter, Social Security will ask you, if that's not your situation any longer, if your income is not what you made 2 years before, you could always, submit the fact that you retired and how much you're going to be making from this point forward, and Social Security will adjust your premium to your current situation. Because again, when we retire, our income will go down drastically, and you may not fall within those categories anymore. All right, another question? Go ahead.
It appears that Medicare does not cover drug expenses then?
So
And
Medicare,
that's why you have Part D?
Medicare has limited coverage for prescription drug. Medicare Part B, as in boy, do have limited coverage for prescription drug. That is for, chemotherapy drugs and expensive drugs that are to treat cancer.
General prescription drugs, then.
Right. So there is a very limited coverage under Medicare Part B, but other than that, then you do have to enroll in Part D, as in David, to be able to have a full range of coverage for prescription medications.
Then the second question is, you indicated that there are medical advantage programs, and you said the premiums tend to be low on that. Is that because you're also paying the Medicare premium?
So some of those plans may help you pay for the Medicare Part B premium, but those premiums are typically lower because the government subsidizes a part of your coverage. So in other words, when we approve these plans to offer to individuals in Medicare, we do pay those plans a certain amount of money every month to have you as a member of those plans. And therefore, the plans are able to offer those benefits at a lower cost because, again, they are getting some sort of subsidy from the government to have you as a member.
Okay.
So that's why the premiums are lower.
Right, because I was just going to, so yeah, that's why you said you could suspend your federal one just so you can compare the medical advantage to your current federal plan.
Right, so you could certainly compare what you have. Like if you go to the Medicare website, it'll tell you, let's say Aetna Medicare Advantage, the monthly premium is $0, or $18 or $5, whatever the case may be. You look at the range of benefits that you will get under Aetna, and then if you have your FEHB plan, you can see or say, okay, so what is my premium with my FEHB compared to $0 to, let's say you were paying $150 for your FEHB premium. That's a significant savings there. And then you can look at the benefits that plans offer and see if it makes sense for you to try it. Then you could certainly enroll in that plan, suspend your FEHB, and try it out to see how it works.
Okay. And one final question. Is your medical premium, does it generally go back 2 tax years? Or 2 years prior to the year you start? Let's put it that way.
Right, as I mentioned, so the IRS will send the last taxes that you file, typically the taxes that you filed last year for the year before. So it's 2018, they're gonna look at the taxes that you filed in 2017 for 2016. So they look at 2 years back taxes. If that situation doesn't apply anymore, if your income is no longer what you made in 2016, you could always appeal to Social Security to readjust the premium amount.
Right, and that was kind of a follow-up to that previous question that you answered. Because your income, what can I say? Your income might change every year, but unless you tell Social Security, they won't change the premium. They'll have what you had initially. Is that correct?
Well,
I'm sorry,
Social Security reassess this every year.
Oh, they do reassess
every year, right? Right. So there are, many individuals when they're retired. Usually, if you retire and a lot of people sell their homes. You may not longer be making that much money, but let's say I retired this year. I am paying the $134. I went on and sold my home to move elsewhere. The proceeds from the sale of that property could affect your Medicare Part B premium for the following year. So when you file the taxes next year and you report that as a capital income, that would probably affect the premium that you will pay for the following year. When the IRS share that information with Social Security, you likely will pay a higher premium for 1 year, and then that goes away because you will not keep reporting the sale of that property as a capital gain.
One of the reasons I asked is, you've got to apply for it, say, within 7 or 8 months after you leave your federal job. if you had a choice, you know, if you retire near the end of the year, you might want to say, well, I'll postpone collecting doing my Medicare premium until the following year because that'll move up my base tax year. So in other words, instead of retiring in early 2018, if I retire in late 2018, then I file for Medicare in the first part of 2019. It'll move my tax year up from 16 to 17, and that may be an advantage to me. Correct? Yeah, follow?
So if you postpone your retirement, let's say.
So it goes into the next year.
It goes into the next year.
As opposed to the end of, say, 2018.
Right, because let's say you postpone your retirement until 2019. Right? Is that?
Right.
You postpone your retirement to 2019, you retire then. Social Security will do the same thing.
You retire in 2018.
So you retire now and apply for Medicare in 2019, right?
Versus late 2018.
Right. So what they would do in 2019, they will send that information to the IRS, and the IRS will be looking at the taxes that you file in 2018 for 2017. So they will be looking back again 2 years. If your income is above those thresholds, they're going to send you a letter. If that's not the case anymore because you already retired, you appeal to Social Security, tell them that's not the case anymore, they'll readjust your income, your premiums.
Thank you.
You're welcome.
Do you apply for Medicare Part A at the age of 65, or do you do it after you retire? Can you do it?
Based on the information that we're given here today, for as long as you're actively working, we recommend not to enroll in Medicare Part B. For A, yes, at the age of 65, you can go ahead and sign up for Part A. You can do it online. You could go Social Security. So we do recommend to enroll in Medicare Part A when you first become eligible, because it could offer additional benefits and there's no premium to it.
I have a list of questions from the internet, so can we allow the people that are viewing to get some answers? So I'm going to just call you out some questions.
Sure.
Okay. I'm retired military and have TRICARE. Presently, FEHB is the primary payer and TRICARE is secondary. When I turn 65 and I must enroll in Part A and Part B, and pay for Part B to obtain TRICARE for life benefits while I'm also paying for FEHB premiums. Is this correct?
That is correct. So you're actively working, you have FEHB, you have TRICARE, FEHB primary, TRICARE secondary. When you turn 65, TRICARE is going to require you to sign up for Medicare Part A and B. Your FEHB will remain your primary health insurance. Medicare is going to be your secondary health insurance. TRICARE is going to be the last payer there. Typically, an individual who has TRICARE and enrolled in Medicare don't really need to have FEHB. So what I would recommend, if you're actively working, you're turning 65, you enroll in TRICARE, I would just go ahead and have TRICARE and Medicare. If for any reason, well, and then you can just get out of the FEHB. TRICARE do count towards the 5 years that you need to take your FEHB into retirement. So what I would recommend is when you turn 65, you enroll in Medicare, I would go ahead and let go of the FEHB unless you really need it. And then before I retire, I'll pick up FEHB. So I can take it into retirement, and then once you retire, you can go ahead and suspend FEHB, put it on hold, and have TRICARE and Medicare. I hope that makes sense. That's I know that's kind of a little tricky there, but what I would say to that individual is that if you have TRICARE, Medicare, and FEHB, you are overinsured. You have too many health insurance. So I would go ahead and determine whether or not I would need FEHB at that time. Likely you probably wouldn't need it because Medicare and TRICARE combine to provide 100% of the coverage. Medicare, as you heard, Part A is free, Part B is $134. TRICARE for life is typically free. So you're only paying Medicare Part B premiums. So I would recommend just to have those two, as opposed to having FEHB, Medicare, and TRICARE. Go ahead.
I got a quick little question. If you're have Part B and you carry your federal insurance with you, okay, and you go in the hospital and Part B carries 80%, you have to pay that deductible amount, and you got 20% is going to fall back on your own personal insurance. You got to pay that deductible out too. Is that correct?
So when you have Medicare as a primary, your FEHB waive the deductible. So you would not have FEHB deductible when Medicare is your primary.
Okay.
So typically they waive what you would typically pay on their FEHB if Medicare is your primary.
Okay.
So no out-of-pocket.
No out-of-pocket. The second question is, you retire and you're looking at signing up for Part B, and you decided you're going to be a non-federal government employee and go work for a corporation, okay? Now, you're going to keep your insurance with the feds, all right? Are you allowed to wait until you finish the second job and then get into Part B without being penalized, or you have to sign up when you retire from the feds?
It all depends. So if you go into that private employer and they offer health insurance and you take their health insurance, then yes, you're not required to sign up for Part B. You will qualify for a special enrollment period. But that's not the typical case. Typically what we do is we retire from the government, we take our FEHB. If you go to work for a private corporation, you likely do not take their health insurance because you already have FEHB. In that case, you are required to, you do have to enroll in Medicare or else pay the penalty. Because although you are working, you don't have a policy through that working employer. Yes.
If I retire before age 65, do I have to wait until age 65 before I can receive Medicare Part B, or I'm eligible to receive Part B immediately upon retirement regardless of age?
So you are not eligible for Medicare until you turn 65. So no, you cannot enroll in Medicare. You will have FEHB coverage up until you turn 65, and then you can sign up for Medicare during that 7-month period if you retire before you turn 65.
My question is, if you have VA medical coverage, how does that affect Medicare coverage and costs?
That doesn't affect Medicare coverage at all, nor does it affect your enrollment periods with Medicare. So TRICARE, VA coverage, if you go to a VA facility they paid for, Medicare doesn't get involved. Outside of the VA facility, if it's not authorized by the VA, then Medicare pays. The VA typically doesn't get involved. Having VA coverage does not entitle an individual to the special enrollment period that we mentioned here for federal employees who have FEHB based on current employment. So if you have VA, that doesn't really affect Medicare much. Again, we don't really combine those two. Those are two federal institutions. So if you get a service at the VA pays. If you go outside without the VA authorizing it, Medicare pay, but those two do not combine like the FEHB and TRICARE does.
This is from a law enforcement agent who is subject to mandatory.
So his question is, if you have VA coverage and you turn 65, are you required to sign up for Medicare? The answer is no. You're not required to sign up for Medicare if you have VA coverage. You're only required if you have TRICARE, but no VA. Good question. Go ahead.
This is from a law enforcement agent who's subject to mandatory retirement at 57. If we are working another job, part-time or full-time, non-federal, when we are 65 in another job, how are we affected?
So again, if you have health insurance through your retirement, which typically you would, if you go and work for another employer and you do not take their health insurance because you already have one, when you turn 65, you need to decide whether or not you want to enroll in Medicare. And, based on the information we're giving today, when you turn 65, you would have that 7-month period to sign up for Medicare, because the fact that you're actively working doesn't really matter because you don't have health insurance through that employer. So again, when you turn 65, you need to decide whether to take Medicare at that time.
Some people I know have the FHEB and Medicare because it says that way they don't have to pay any deductibles. But I look at it on the other hand, if you just have the FEHB and not Medicare, you're saving maybe $400 to $500 every month for a married couple. It would appear to be to your advantage not to carry Medicare.
Well,
am I missing something there?
Well, again, for a single individual, a Medicare Part B premium is about $1,600. For a married couple, you multiply that by 2, so you're talking about $3,000 a year. Now, your maximum out-of-pocket through your FEHB for a self plus one or family is from $10,000 to $15,000. So just multiply that. Compare $3,000 with $10,000 to $15,000. If you're utilizing the full benefits, it would be much more advantageous to have Medicare. Needless to say, the services that we discuss here that are covered by Medicare but not by the FEHB. So that is to say, as I said in the beginning, you may be able to see some savings in the short terms. Yes, if I am not utilizing that much services, maybe paying that $3,000 a year, we wouldn't be saving that for as long as we don't get Medicare. But if it comes a time that you would need Medicare, that saving is going to dissipate quickly in the next few years, and that is for the reasons that I mentioned before.
No, I understand, because I've got long-time care, so that
Right.
would cover, long care would cover the facilities if I needed it. So, and as I said, I'd be in the $200 a month for one person, so that's $400 a month for a couple times 4, it could be quite expensive.
It does. If you're not utilizing the service to the fullest, yes, you would be saving some money. But once you need the service later on, if both of you signed up later and then both of you have to pay that penalty,
right. No, I understand.
Then that savings is going to, in the long run, is going to dissipate. Typically, here's the typical stories of we as federal employees, and we retired, and we go into retirement, and typically something happened. For us to remain healthy and to live a life with more quality, typically if you need physical therapy, occupational therapy, those things are very expensive. If you only have FEHB, what your doctor or social worker, whomever the case may be at the hospital, will tell you is, these services are non-existent with your FEHB. So we would recommend for you to enroll in Medicare. At that time, unfortunately, you can't just enroll in Medicare. You have to wait until the end, until the beginning of the following year, and then wait until July because the coverage doesn't start right there and then for the coverage to kick in. So, and then you're going to have to start paying penalty for the long run. So that is the typical situation, that sooner or later someone along the way will tell you it's better for you to go into Medicare because you're going to have much more coverage under Medicare than what you typically have with your plan right now. All right, any more questions?
I had a question about paying the Part B premiums. If you are receiving Social Security benefits, when you elect to start Medicare, I have heard that they'll just take those premiums out of your Social Security benefits. Is that true?
That is true.
Okay.
If you're getting Social Security benefits, it's going to come out of there. If you're not getting Social Security benefits, but you're getting an annuity, it's going to be taken out of your annuity.
Oh, well, okay, because that was my other question is, are you billed for it or what? So they'll just take it out of your annuity?
Correct.
Is that done monthly, quarterly, or?
Monthly.
Monthly. Okay, thank you.
You're welcome. All right, well, thank you so much for having me. If you have a question, a personal question, I'll stick around, be happy to answer any.
We'd like to thank you for coming. We do have a certificate of appreciation from DEA that we would like to present to you and to say thank you for coming.
And thank you for having me. It's an honor.
Thank you.